Yes, Greeshma, Shankaram, you can start now.
Uh, Good afternoon.
Good afternoon, nurse.
Let me introduce myself. I'm Greeshma, one of the registered nurses working in this reception center at the public hospital. How may I help you today?
Yes, nurse. Actually, I came here regarding my father. My father's name is Lincoln, and I am John. Yeah, my father
Okay,
is
sir.
81 years old, and he has recently been diagnosed as suffering from kidney failure.
Hmm. Okay, John. Thank you for giving details regarding your father's condition. Could you please tell me what you already knows about your father's conditions and also about dialysis?
I do not know anything about that, nurse. I don't know what is the dialysis. What exactly is a dialysis? Can you can you tell me everything about that, please?
Okay, John, sure, I will explain regarding dialysis. But before explaining dialysis, can I explain regarding what is kidney failure and how it was happened?
Yes, I want to have the detailed information about my father's condition. You tell me about kidney failure and everything related to that, nurse. I'll be very thankful to you.
Sure, John. First of all, I will explain about kidney failure. Kidney failure is also known as renal failure, and it is the loss of kidney's ability to effectively filter waste products and excess fluid from the blood. And this can be lead to the dangerous levels of waste buildup and electrolyte imbalance. The possible symptoms includes fatigue, swelling, shortness of breath, and confusion, and the treatment is often includes dialysis and kidney transplant. So is this clear regarding kidney failure?
Yeah, I understood what is kidney failure, but I want to know more about this dialysis. What is involved in dialysis? What is it exactly? And why does my father have to come 3 times a week?
Yes, John, your concerns are very reasonable. So dialysis is the main procedure that is very useful in the kidney related problems, and it is the machine which cleans and filter the blood, and it acts like a kidney in the kidney failure patients. So is this clear for you?
That's fine. But why should my father have to come 3 times a week? That you did not explain me, nurse.
Your concerns are very reasonable, Mr. John, but your father treatment is mostly depend on the dialysis because it is the own. There are two options for the kidney patients: dialysis and also kidney transplantation. And kidney transplantation may leads to kidney after transplantation. It may lead to rejections, and dialysis is acts like the kidney, and which helps to filter the blood. If the blood is not filtered properly, it may lead to some complications. So that is the reason your father is asked to treat with the dialysis 3 times a week. Are you able to follow me?
Yeah, of course. Will this will this
Hello.
one second. 1 second, please. So, will this dialysis treatment be painful? Will it have any side effects?
Yes, John. So this kidney failure is very rarely and unlikely to your father will start working kidneys working again, and this dialysis treatment is painful and has some side effects like fatigue, low blood pressure, and high blood pressure, muscle cramps. These are the side effects. So do not worry about your father. Your father is at the right place, and Here, all the staff members are very well trained, so we will take care of your father. Is this clear for you?
Yeah, of course, that's very clear. And yes, yes, yes. And so what do you suggest me to do, nurse?
Yes, John. Obviously, it is very beneficial for your father to do dialysis 3 times a week, and follow the appropriate management which doctor will tell to your father. So this is very helpful for your father to get cured very faster. Is this clear? Do you have any concerns
Okay, will
regarding
this
this?
dialysis treatment help to improve my father's current medical condition? In what ways?
Yes, uh, yes, John. Your father will continue the dialysis treatment, and it will helpful for your father to filter his blood instead of kidneys function. So if your father is not able to take this dialysis regularly, he may become very ill. So are you able to follow me?
Yes, sir. I'm able to understand that one now. Okay.
Do you have any queries regarding this?
Yes. I have one more question to ask you. Okay. I have
Okay, you
one
can
more
proceed.
question to ask you. My father is 81 years old. Then ask what could happen if he decides not to continue with his treatment.
As I told to John before, that if your father is decided not to continue with his dialysis treatment, your father will become very ill, and for your father, it is the right treatment to cure and also to continue his life, because other options are not suitable for your father, as your father is getting older. Is this clear?
Yeah. Of course, of course. I agree with you 100%. I will talk to you, my father. I'll definitely talk to my father and I'll try to convince him. And yeah, yeah, thank you very much for the valuable information, nurse. That's really very
Okay, John.
kind of you.
Okay, okay, John. Other than this, do you want to ask anything?
No, nurse, that's quite clear and everything is fine.
Okay, John. Thank you for patient listening and also cooperating with me. And if you have any more queries regarding your father's condition and all, you can contact me. I will be in this reception only. Thank you, John. Have a speedy recovery of your father.
Yeah, thank you very much. Thank you very much. Yeah. So, right. Yes, Greeshma Shankaram.
Yes, sir.
Yes. Grishma Shankaram, you're doing well. Definitely, no doubt. You have that subject knowledge, but grammatical wise and expanding the, flaunting the knowledge which you already have, it is getting little difficult. You have to come out now. You have to come out with that one. How you can come out is by regular practice. From now onwards, I want you to do one speaking session every day, if possible. If I give second session, you can. If I am free, you can take another session also. So you
Okay,
have a
sir.
privilege because you are regular student. Sometimes I'll take 5 6 speaking sessions also once in a week. Half an hour I'll give you on speaking day. Okay, so that day you can do some 5 or 6 speaking sessions also, and you can practice. Otherwise every day you can do at least one. If you have the time, you can do 2 speaking sessions, one in the morning, one in the evening also. So now coming to the point, your subject. Yeah, you have some panic, you have some hesitation, unnecessary sounds, and idea generation. Sometimes it takes a little time, 1 or 2 seconds, or sometimes even 3 seconds to generate your ideas. So everything is fine. You are doing well. You are doing excellently, and I really appreciate your concern. I really appreciate your concern. and the way how you are responding to the patient. You are concerned with the patient, you are concerned with his tension, upset and worry, and you are trying to explain him very clearly how not to worry and how to deal with the situation, and you are giving him detailed information. Everything is fine. And you say, many people, all the students, whoever spoke today, they said father condition, father body, father treatment, father, like that, father's condition, father's treatment, father's body, father's um, problem, like that. Father apostrophe, yes, that is the mistake everyone is doing. You're not the only one doing this one. And like that, take some sentences, standard sentences, try to keep them, try to learn them, and try to adapt them. Don't speak as it is as a ratta by hearted sentence, but you can modify them and you can adapt them into your sentence. For example, for this situation, you can talk like this: since he is your father, and you're not ready to see the pain, that you're not able to bear the pain he's suffering, you feel, yeah. So that's the reason why you're worried, you're tensed and upset. But let us think normally. Okay. Let us think normally. There are many other patients who are undergoing this problem. This is not the your father is not the only individual who is facing this problem. Of course, father is only, he is the only father for you, but there are many people who are facing this problem, kidney failure. So what exactly is kidney failure? Now let me explain you very clearly. There, when we eat and drink, we produce many unnecessary, we take in the required ingredients, required minerals, required chemicals and other things, and the remaining parts, no, the remaining aspects, for example, unwanted things, they should be eliminated from the body. We eat many things, okay, we consume many things. All these things are not 100% useful to the body. There may be 20% or 15% or 10% or 25% things which are useful to our body. The body takes only those things, and the remaining parts of the body is there in the body itself. These unnecessary materials should be eliminated under any circumstances. They're not supposed to be in the body, because these will produce toxic substances and poisonous gases in the body, and these will result in complicated situations. So for that purpose, kidney is the organ which cleans the blood like a sieve. It will filter all the unwanted chemicals, materials, and liquids, and will send through the blood to in the form of urine or feces, and gases also through the lungs. So the kidney will filter all these unnecessary materials, and the purified blood will be recycled. Recycled. And this purification of the body is very, very important. Now, in your father's condition, the kidney is not in a condition to manage this function appropriately and eliminate the unwanted materials produced in this body. Byproducts. Byproducts of respiration, byproducts of digestion. Yeah. This is very difficult. So for that purpose, now we cannot live like that, right? If it the natural process is not working, we should do something alternative. We should resort to alternative methods, right? Now these alternative methods are very important. Okay. So this is dialysis. In this now let me explain you about dialysis. Dialysis is a machine. Dialysis machine is a machine. You said mission. It's a mission. No, it's not mission. It's machine. Machine. Mission is MISSION. Machine is MACHINE. So it's a mistake. It's a mistake. Geneva Anto, I was searching for you. Where did you go? Wait, don't miss. After Keval, there is a Tanuja. Then after Tanuja, I'll take your speaking. Because these are the lectures which I give. These are very important for you because you are going for the exam. Okay, it's more important for you than others. Others can watch in the YouTube also. You don't miss my sessions at any cost. So, now here, this machine is a machine, so it does very fast. It does the work of 100 kidneys. So instead of doing continuously, kidney does continuously in a slow process, but this machine does in a short time, does a 2 days job in short time, or 7 days job in 1 day, short time, maybe 1 hour or 2 hours. Because this is a machine, it purifies very fast. Okay. So now you cannot continuously keep this machine. So if it is a condition is no, as a very ordinary mild condition, we use once in a week. If it is moderate, twice in a week. If it is critical, thrice a week. So thrice weekly dialysis is required for your father because your father's condition is beyond critical. It's extremely difficult situation, complicated situation. And the condition warrants thrice weekly dialysis. I hope you understand. How does that sound? Is that very clear to you? I think now you understand what exactly I mean and the condition which your father is in. And that is the reason why it is very necessary to. That's it. Krishna. Yeah. So that is the point. So you should understand these things very clearly and you should explain these things. Is that clear, Greeshma? Greeshma. Unmute. What happened?
Yes, sir.
Is that very clear? Don't get upset or angry with me, okay? It is my duty that I am doing.
No,
Maybe
sir.
I will shout also. You take it. If you want to make a diamond, you have to hit it hard 1,000 times with a, you understand, chisel and a hammer, right?
Yes, sir.
I'm explaining you for your own benefit. Don't think that sir is showing too many mistakes or whatever. I'm giving you importance and I'm explaining you all these things. So that is done. Do you have any more doubts? You can ask me.
No, sir. It's clear, sir.
Yeah, right.